The American Cancer Society reveals an increase in cancer diagnosis among younger adults.
The World Health Organization says cancer cases are on the rise around the world, and medical professionals are seeing it firsthand.
All right, guys, so I just got to the operating room here at the hospital and about to do a case. But later today, I have to head to the office to see a patient. This is not a typical clinical day for me. I'm usually in the operating room today, but I have to make an exception. I got a phone call late yesterday from the radiologist who was concerned about a patient that I got an MRI on that there was a large tumor. And typically, this is not something that I have to commonly do to tell a patient that they have cancer, but today we're gonna have to do that. This is something that we're not trained to do, especially as spine surgeons, orthopedic surgeons, is really to kind of relay this information. There's a couple different things that I worry about in this situation. I do worry about the patient and how they're going to react to this. Secondly, how's this patient going to navigate this whole process with chemotherapy, with resection, tumor removal, and just going through this whole process, which is life-changing. Those are some of the thoughts that have been going through my head, and I mean, I'm really nervous about meeting with this patient. All right, guys, so I just got to the office and about to see this patient. I typically get this question all the time. Hey, Dr. Webb, what do you enjoy most? Being in the clinic or being in the operating room? And I actually enjoy both of them. I do find pleasure and fun, and I enjoy being in the clinic, talking to patients and just interacting with various patients. I've treated professional athletes, lawyers, business people, politicians, but and that's really the fun part. What I don't enjoy is this, having to tell a patient that they have cancer. You know, that's unfortunate, but that's what I have to do, and part of my job that I don't necessarily enjoy doing. So my medical assistant just texted me stating that the patient is in the room waiting on me, so we'll go up and talk to the patient. Something that I've been dreading since last night when I found out. Just gotta make it happen now. All right, so the time we spend in clinic as surgeons can be extremely busy. There are a lot of moving parts, patients that are in pain, patients that come in with weakness, patients that sometimes are paralyzed that come into my office and have fractures, a lot of socioeconomic things, so a lot of moving parts. What I found to be very successful and very effective, efficient, is utilizing a lot of the technology that's out there these days. So I've been using a platform called Mobius Conveyor. Once I say that I can't run my clinic without this, I've been using this for several months now. I can't actually recall how much time and effort I spent just typing up what the patient's telling me about their complaints, about their history, about what's going on, the previous surgeries. So what I found to be most efficient after, once I'm seeing 30, 40, 50, 60 patients a day, is to use a platform that helps me be more efficient. This is Mobius Conveyor. It's a AI generated platform app that I have on my phone. What I do is I walk into the patient's room, it captures what the patient is saying, and it puts it into a app here. I transfer that to an EMR. It's able to be used on any EMR, really easy to use. It's allowed me to be more efficient, and it keeps me more focused and attentive to the patient at hand. So I'm not sitting here at my computer trying to type up everything that they say. So I've used it, like I said, several months, and it's a game changer. So check out Mobius Conveyor. There's a link in the description for 10% off of your subscription, as well as they will give you a 7-day free trial. So thank you for the sponsors of this video, Mobius Conveyor. Clinic. It's certainly a time that some people may not enjoy as surgeons because you're not in the operating room. I find a lot of joy in doing it and just meeting patients and interacting with patients and learning about them and where they're from. I have a lot of patients that travel in to see me, so this is it's a good time to spend with patients that's not in a stressful environment like the operating room. So I'm about to go see this patient. This case here just speaks to the importance of collaboration. And also the importance of making sure that if something is bothering you, come in, don't wait for it. There's, a lot of males per se, they wait to the last minute until your wife makes you come in, or your significant other, whoever you're married to, makes you come in. You don't want to do that. So if something is of concern, if you have weakness, numbness, tingling, any concerns neurologically, come see a spine surgeon or your primary physician, because if this wasn't caught, this patient certainly could die from this. So I'm about to go see him and just do my best in terms of relaying this information to him. So. Hello, how are you guys doing?
Yeah, how about yourself?
Yeah, doing well.
Yeah,
Thank you. It was not too bad. So I was able to review the MRI that you recently got, and I also reviewed the MRI with the radiologist. And I typically do this if I'm concerned about any of the findings on that, any imaging studies that we order, or if there is something that is of concern. So I see the reason why you're having this weakness in your legs and in your feet. You have severe spinal compression. What's more concerning is that the MRI showed that you have cancer. This is certainly not something that I'm sure you wanted to hear today, but I want to be very clear that I think we should be very aggressive in this, because this is certainly something that can kill you. Whenever there is something that's outside of my expertise, this speaks to the highlights and the importance of having collaboration. So, I'm a spine surgeon, I address the spinal issues, but when something's outside of that realm, we need to get other people involved, and that's generally a hematologist, an oncologist, the radiologist, your primary physician, to effectively treat this together. So, I'm gonna be here with you every step of the way. I'm sorry I had to break this news to you today. And, if there's anything I can do, please let me know. What I want to do is see you back after you see the hematologist and oncologist, and check in with me. If there's anything else I can do for you in the meantime, please let me know. All right, so you guys sit here for a second. I'll have my medical assistant come in and print some orders out for you, and she'll be right in though. All right, so this Mobius platform, as I'm coming out of the room, typically I just hit stop and generate summary. And what that will do is generate a note for me. So it's very similar to this right here. It prints out the history, the physical exam, kind of what we talked about, and it comes up with an assessment plan. With one click of a button, this goes into the patient's EMR, their electronic medical record, and my note's done. So it makes it very efficient. But I have a few more patients that I have to see here in the office, and then I'm heading about 20 minutes away. We're going to a studio to film. I was asked to be a part of this podcast for a attorney here in town. So he has a new podcast that he started. He invited me to be a part of that podcast. So we're gonna do that next. All right, guys, so just got downtown San Antonio, about to do the podcast interview. And yeah, should be a lot of fun, just chatting about my experience as a spine surgeon. Yo, hey, where you, man? Antonio Webb.
Carl.
Nice to meet you. Looking sharp.
Good to
Absolutely,
see you.
man.
Same to you.
We'll be here. Okay.
I thought it would be a great way to put ourselves out there.
Yeah.
I know you're a businessman in addition to being a surgeon. You got your, social media going.
Yeah.
And I'm trying to do the same.
Yeah.
So great way to just put ourselves out there.
Absolutely,
Upload some
man.
content, TikTok, Instagram.
Yeah.
You might be able to show me some pointers as well. Man.
Yeah. How's practice, man? It seems like you hustling, man. I see it.
And I am,
Yeah.
man. I was actually in Dallas. Hi, I'm Nathaniel Mack. I'm the host of Mack in Action. Now, tell the ladies and gentlemen a little bit about your journey to becoming a spine surgeon and why you specifically chose that specialty.
Yeah, so it goes back to wanting to do this since I was pretty young. I attended a medical magnet program, and that program got me interested in medicine and is the reason why I'm a doctor today. But orthopedics, kind of fell in love with that in medical school, and just love working with my hands and rebuilding things, putting things back together. So I love the reconstructive aspect of it, and that's what I really enjoy about orthopedics. And spine surgery, it's it's one of those fields that's very fascinating and quickly changing. A lot of new technology that's coming out these days in terms of how we can do surgery more safe and efficiently. All right, guys, so that concludes my day. Had a pretty long and exhausting, mentally draining day. Just meeting with the patient about the cancer diagnosis, and then seeing clinic, surgery. Now I'm finishing up with a podcast interview, so about to head to the house, get some rest, and do it all over again tomorrow. Thank you guys for watching. We'll see you next time.